This video resource is for patients with diabetes and chronic kidney disease. Details of the video content can be found at the bottom of this video. You can choose to look at different topics by clicking on the timestamp below. Diabetes is a condition where glucose increases due to the body not producing enough insulin, or the body not using insulin effectively. Diabetic kidney disease, DKD, also known as diabetic nephropathy, is one of the diabetes complications. It may occur in type 1 diabetes in more than 10 years, or newly diagnosed type 2 diabetes. According to Diabetes UK, about 40% of the diabetes population, both type 1 diabetes and type 2 diabetes, will develop chronic kidney disease during their lifetime. When the kidney function is reduced, it will lose the ability to remove excess fluid and waste products from your body. Reduced kidney function can be detected clinically by increased urinary albumin excretion. Albumin is a type of protein in our blood. Microalbuminuria develops in 20 to 40% of people with diabetes within 10 to 15 years of diagnosis, of whom 80 to 90% progress to more severe disease and potentially end-stage kidney disease. There may not be any visible symptoms in the early stage of kidney disease. However, when kidney function deteriorates, you may notice the following symptoms: oedema, which presents itself as swollen ankles, feet, hands and face, blood in the urine, fatigue, shortness of breath, and nausea and vomiting. According to British Medical Journal Best Practice Guideline 2022, the main ways to slow down diabetic kidney disease are good blood glucose control, maintaining good blood pressure, maintaining a healthy body weight and shape, following a diet which is suitable for your requirements. HbA1c is your average blood glucose level over the last 2 to 3 months. According to the British Medical Journal Best Practice Guideline 2022, if you are at risk or have already developed diabetic kidney disease, you are advised to aim for HbA1c 6.5 to 7%, i.e. 48 to 53 millimoles per mole. The glycemic target varies depending on the type of diabetes, stage of chronic kidney disease, albuminuria, and age of the individual. For type 2 diabetes, you should aim for blood glucose readings between 4 to 7 before meals and not higher than 8.5 90 minutes after meals. For older people and people who are at higher risk of hypos, their target range is 3.9 to 10. This group of patients should aim to keep their readings in the middle to the top of the range to prevent low glucose levels. You can improve your blood glucose control by evenly distributing your carbohydrates throughout the day, limiting simple sugars such as table sugar, confectionery, desserts and high sugar containing pastries. Please make sure to comply with your diabetes medications and insulin regime. Don't forget to regularly check your blood glucose and attend your diabetes appointments. If you have any doubt about your diabetes medications, insulin regime and insulin to carbohydrate ratio due to your kidney condition, please contact your GP or diabetes specialist team for discussion. There are 2 types of carbohydrate foods: complex and simple carbohydrates. Complex carbohydrates are mainly starchy foods such as whole grain breads, rice, pasta and potatoes. This form of carbohydrate needs to be digested and are broken down into glucose slower in the bloodstream. You are recommended to choose higher fibre options such as potatoes with skin, wholemeal bread and pasta so as to stabilise blood glucose and help us feel fuller for longer. Complex carbohydrates should make up a third of our overall intake. Simple carbohydrates or sugary carbohydrates are short-chain carbohydrate molecules which are quickly being absorbed from the guts to the bloodstream. These include foods such as chocolate, sweets, cakes, biscuits and sugary fizzy drinks. Sugary carbohydrates can cause blood glucose levels to rise quickly. Therefore, it is best to limit your intake of these foods. These foods often have high calorie content and can therefore lead to weight gain. All carbohydrate foods affect blood glucose levels. You're recommended to choose the healthier, less processed and higher fibre options such as fruits and vegetables, pulses, unsweetened dairy and whole grains. The recommendations for blood pressure in people younger than 80 years old with diabetes with kidney disease is below 130/80. Blood pressure target is usually below 140/90 for people with diabetes or below 150/90 if you're aged 80 years or above. You can speak to your healthcare team about your individual target. Keeping blood pressure within target may reduce urine albumin loss and slow progression of kidney disease. Patients with chronic kidney disease and type 2 diabetes are recommended to consume less than 5 grams of salt per day. This equates to less than 1 teaspoon of salt per day. This is a stricter recommendation than for the general population. All forms of salt, including sea salt, rock salt and Himalayan salt, should be limited. Beware of products labelled low salt or reduced sodium, as these can be high in potassium, which is not suitable for chronic kidney disease patients and people with cardiac conditions. A diet high in salt can increase blood pressure, putting a strain on your heart. It can also lead to fluid retention in those with more advanced kidney disease. High salt intake can increase thirst, making it harder to keep to fluid restrictions if required. Processed foods and takeaways contain high amounts of salt. Cooking from fresh is a good way to reduce your salt intake. You're encouraged to avoid adding salt at the table and try flavouring food with pepper, herbs or spices. Reading food labels is a good way to find out how much salt is in a food. The traffic light system clearly shows if a product is high, red, medium, amber or low, green in salt. You're recommended to choose foods with less than 1.5 grams of salt per 100 grams. Obesity is defined by body mass index, BMI, more than 30 kilograms per metre squared. Maintaining a healthy body weight can help slow the progression of chronic kidney disease. For overweight and obese patients, losing 5 to 10% of body weight can improve blood glucose, blood pressure and cholesterol levels. For overweight and obese patients with type 2 diabetes, research has shown reduction of 15 kilograms, 2.5 stones, can reduce blood glucose levels back to a non-diabetic range, and you may even stop your diabetes medication. Keeping a healthy waist circumference can reduce the risk of developing diabetes and cardiovascular disease. A healthy waist size depends on your gender and ethnicity. It should be less than 80 centimetres for all women, less than 94 centimetres for most men, and less than 90 centimetres for South Asian men. You are encouraged to do at least 150 minutes of moderate intensity physical activity per week, depending on individual cardiovascular and physical tolerance. Physical activity for diabetes can improve insulin sensitivity and cholesterol levels. Keeping active can improve quality of sleep, improve joints, flexibility, reduce stress levels and low mood. Please speak with your GP before commencing new intense physical activity. Protein is important for cell growth and repair. You will need to make sure you are consuming an adequate amount of protein for your well-being. Excessive intake of protein in the early stages of chronic kidney disease can harm the kidneys. It is recommended that patients with chronic kidney disease who are not on dialysis should aim for 0.8 grams of protein per kilogram of ideal body weight per day. Those on hemodialysis or peritoneal dialysis require higher protein intakes of 1 to 1.2 grams of protein per kilogram of ideal body weight per day. For instance, based on this guidance, a 70 kilogram person with chronic kidney disease who is not on dialysis should consume approximately 56 grams of protein per day. If you are concerned about food appetite and weight loss, you can request that your diabetes or renal doctors and nurses refer you to see a dietitian. Your dietitian will assess your intake and decide if you need any adjustment to your dietary protein intake. Here are some common protein-containing foods. Dietary protein comes from both animal and plant sources. For animal sources, you are recommended to have lean meats, which are low in saturated fats, such as poultry without skin. You are also recommended to have fish twice a week, with one portion being oily. Limit the intake of processed meats, such as sausages, bacon, chicken nuggets and battered fish, as these are high in saturated fats and salt. For dairy products, reduced fat options should be a preferred choice, such as semi-skimmed milk or skimmed milk and low-fat yogurt and cheese. Lentils and pulses, such as tofu, are all good sources of plant-based protein. You can include more plant-based proteins in your diet by replacing half of your beef or lamb mince with lentils when making shepherd's pie or spaghetti bolognese. When making chicken-based dishes, such as casseroles or curries, you can replace half the chicken with chickpeas. You can also try making vegetarian chili con carne with a variety of beans, or vegetarian lasagna with vegetables such as courgettes, peppers, sweet potato or aubergine. Research has shown a strong link between heart health, type 2 diabetes and chronic kidney disease. Blood cholesterol targets depend on individual comorbidities such as diabetes and chronic kidney disease. High levels of blood cholesterol can increase risk of cardiovascular disease. Summary of lipid targets based on different guidelines for healthy adults and people with diabetes is shown here. Diets high in saturated and trans fats have been shown to increase the levels of bad cholesterol, LDL, in the blood, leading to a higher risk of developing cardiovascular disease and increase the progress of chronic kidney disease. Here are some examples of food high in saturated fats. You are recommended to reduce your intake of saturated and trans fats, replacing with poly and monounsaturated fatty acids. Scientific Advisory Committee on Nutrition recommends limiting saturated fat to 20 grams per day for women and 30 grams per day for men. Trans fats are found in processed foods such as takeaway foods. Traffic light symbols on food labels will show if a food is high, medium or low in fat. In advanced chronic kidney disease stage 4 to 5, in addition to following your healthy eating diet for ideal blood glucose and blood pressure control, you may have to restrict the amount of potassium and phosphate-rich foods and avoid excessive fluid intake. Please remember, you will not need to restrict your dietary potassium and phosphate intake until you are advised to do so by your doctor and nurses. If you require dietary restrictions, you will be referred to a renal dietitian. Details of low potassium and low phosphate diets can be found in separate videos. Other general advice for diabetic kidney disease include reduction of alcohol consumption, stop smoking, and avoid excessive caffeine intake. Alcohol should be limited to no more than 14 units per week for men and women. You are encouraged to keep 2 to 3 alcohol-free days per week. Let's compare 3 menus to see how small changes improve the overall nutrition content of the diet. Menu 1 comprises of some processed food such as burger and frozen chicken Kiev. All the dairy products used in Menu 1 are full fat, such as butter, full fat cheese, full cream milk and full fat salad dressing. It contains the highest amount of animal fats compared with other menus showing later. The total calorie content of the meal is high, as meats such as burger and chicken Kiev and chips are all deep fried. The diet also consists of simple sugars from sugar-containing fizzy drinks, fruit juice from concentrates, sugar used in coffee and chocolate biscuits. The calorie content of this diet is about 3,500 calories, with 70 grams of saturated fat. In Menu 2, all the daily products from Menu 1 are changed to reduced fat options, such as low-fat cheese, semi-skimmed milk, and reduced fat salad dressing. A full-cooked breakfast is replaced by a slice of toast with jam and coffee with milk. As for lunch, Deep fried chicken Kiev is replaced by chicken salad with low-fat dressing, with the same amount of protein but lower in animal fats. Low-fat cheese instead of full-fat cheese for macaroni, cheese and toast. The calorie content of this diet is about 2,750 calories with 26.8 grams of saturated fats. By reducing the animal fats and portion sizes as in menu 2, the total calorie intake has significantly reduced from 3,500 calories to 2,750 calories, which is a 20% reduction. Saturated fat has reduced from 70 grams to 27 grams, which is a 62% reduction. In menu 3, simple sugar in coffee, fizzy drinks and fruit juice are replaced by sweeteners, diet fizzy drinks and diet squash. When compared with menu 2, the total sugar content reduced dramatically from 142 grams to 35 grams, which is a 76% reduction. The total calories also reduced from about 2,700 calories to 1,630 calories per day, which is about a 41% reduction. Menu 1 is a high-fat, high-sugar and high-salt diet. After changing to menu 3, which is a diet low in saturated fat, simple sugar and salt, the menu is more suitable for a person with diabetes and chronic kidney disease. By changing the food choices and cooking method from menu 1 to menu 3, the total daily calories is reduced by 53% and total daily salt intake is reduced from 10 grams to 5 grams per day, which meets the national guideline recommendation for diabetes with chronic kidney disease. When diabetic kidney disease progresses, your appetite may reduce and you may have issues with hypos. Your blood potassium and phosphate levels may also increase. Your dietitian will be able to advise you when and how to adjust your dietary intake so as to avoid or delay morbidity and mortality. Intensive dietary treatment can stabilise blood glucose levels, improve blood pressure and fluid retention caused by excessive salt intake, and improve blood cholesterol levels. If you have any concerns about your diabetes, please contact your GP or diabetes specialist nurse. If you would like to look up or revise certain content of this video, you can click on the timestamps below. Here are some useful websites for further advice about diet, diabetes and chronic kidney disease. You can also find them at the bottom of this video.